We're joined now by the coordinator of the coronavirus task force at the White House, Dr. Deborah Birx. Dr. Birx, good morning to you. You just heard these stats. You know them well. 4 million cases in this country now. We added 1 million just in the last 16 days or so. Before that, it took months to get to those kinds of numbers. Deaths reported 1,000 yesterday. Haven't seen a number that high in weeks. You're the head of the task force here. The president says it's going to get worse before it's going to get better. How much worse?
Well, it really depends on the next set of cities. I mean, we already starting to see some plateauing in these critically 4 states that have really suffered under the last 4 weeks. So Texas, California, Arizona, and Florida, those major metros and throughout their counties. And I just want to make it clear to the American public, what we have right now are essentially 3 New Yorks with these 3 major states. And so we're really having to respond as an American people, and that's why you hear us calling for mass and increased social distancing to really stop the spread of this epidemic.
You know, there are those who doubt that this is real, or they think it's kind of overblown. They say you get more testing done and then you're going to get more cases, or it's only young people. I mean, and they don't get as sick. From your perspective, you have a chance to get a message across here. Is this outbreak real, and is it serious?
Well, it's very serious and it's very real. That's why I have been traveling around the country. I've been to 9 states. I go to 5 more over the weekend and early next week. Because what really matters is translating information into action and really sitting with governments and communities and governors and mayors and really working towards an effective response community by community, utilizing the guidelines that are available. That's what we need across America. And I really applaud the mayor of Miami, who said if you have in a multi-generational household people with comorbidities independent of age, young people that may have obesity or hypertension or diabetes, it is a responsibility of all of us to protect them when they're in public by all wearing masks, but to also protect them in the household, because this first wave that we see now across Florida, Texas, California, and Arizona began with under 30-year-olds, many who were asymptomatic and didn't know they were spreading it. And so they have to assume that they're infected and positive, and we all need to protect those who need our protection right now.
That brings us to schools. The CDC out with some new guidelines today. There's enormous pressure on schools to reopen in person. In fact, there's been a threat to withhold federal funding from schools that don't. The president has said, you know, children don't get the virus as much, and if they do, they get better quick. I think you said in an interview a couple of days ago, there's an open question and you're studying it. If it's not known, how are schools supposed to safely reopen? What are parents to think if we really don't have the science and we don't know the answer to those questions about how much kids are passing it on and how much risk they pose?
You're absolutely right, Savannah. Knowledge is power. And I think why that was very important that the president yesterday had the map behind him showing where the most recent cases are. Those were the cases over the last 7 to 14 days, really to inform the public that there are areas in the United States where cases are rapidly increasing and continue to increase. And in those cases, and with the new CDC guidelines, to really give parents, school administrators, teachers, and the county supervisors really an understanding of where they are in the epidemic and what precautions they need to take. What I can't really tell you today is whether children under 10, we know that children under 18 are less sick, but there are some that suffer terrible consequences if they have underlying conditions. What I can't tell you for sure, despite the South Korea study, is whether children under 10 in the United States don't spread the virus as the same as children over 10. I think that is still an open question that needs to be studied in the United States. We certainly know from other studies that children under 10 do get infected. It's just unclear how rapidly they spread the virus.
What went wrong here? Because, you and I last talked, I think, in early April, and you were talking about if we just stick with the 30 days guidelines, then we'll avoid an acute second wave. Well, we did. I mean, the country did shut down for the better part of those 30 days. And yet here we are. And it was New York then in the hot spot, but these areas like Texas, California, Arizona, Florida, now they have seen a wave. What went wrong, and how? And it's an important question to answer now because, of course, we're still in this epidemic, and we don't want it to be a new hot spot. So, what have you learned?
I think what's really important is to understand when you first see that increase in test positivity. We put out gating criteria about how to open safely and how each of the individual sections that you had to move through were critical. We also know now, and it was in that original gating criteria, about test positivity. And I think we have a lot more knowledge now that when it just ticks up a little, even before you see a significant increase in cases, that is a real indicator that something is happening. And this is why it's important. So much of that early spread in 20 to 30-year-olds is asymptomatic. They would never appear at an emergency room or a testing site. They would have no reason to do it. But when we put out the call after Memorial Day, and I just want to thank the young people for their responsiveness, we asked them after Memorial Day, when we could see Americans on the move, that if they were in large gatherings, no matter if it was in the street or in a bar or in a private home, to go and get tested. And I think it's because of their responsibility we were able to see that original tick up. But until you can see that explosion, it's hard for people to understand how deeply you have to clamp down. And that's why we called out the next set of cities where we see early warning signs, because if you make changes now, you won't become a phoenix.
And very, very quickly, the president has decided to cancel the public portion of the Republican National Convention in Florida because of the virus. Was that the right call?
The president said when we did Opening Up America Again guidelines that he would step in when he saw things that had to be corrected. And I think you see this week him really talking to the American people about how important masks are and how important not being in mass gatherings are, particularly if people are not wearing masks. This is a signal to the American people. We have to change our behavior now before this virus completely moves back up through the north. We can do that, and we can do that as an American people.
Do you wish that he had been more outspoken, for example, on masks a little bit earlier? You just mentioned how important it was that he spoke up so clearly this week.
I think he's been speaking about masks. The vice president has been mirroring that behavior. I think many people know I am always in a mask to mirror that behavior. I think it's really important to signal to the American people how critical mask wearing is, but also social distancing.
All right. Dr. Birx, thank you very much.